Looking at the ways treatments are changing, when I started my career about 20 years ago, a lot of the medications were still given as intravenous therapies within the healthcare facilities. With hematology patients in particular, they tend to be a little bit more advanced or a little more ill compared to patients with solid tumors. The treatments themselves too can be more intensive, often necessitating an inpatient hospital stay. We are seeing now a move or a shift from these chemotherapeutic agents to more targeted therapies. So understanding the targets on the cells, understanding the pathways which the cancers will proliferate is really important, and it's key to education and it's key to understanding. But once you do identify these targets, then you can individualize the care for the patients. So having the ability to give, one or two specific agents rather than a plethora of, 6 or 7 agents, I think is going to be really exciting. And we're starting to see that now. We're starting to see patients coming in, having tissue samples and blood samples and having their tumors profiled to really identify and drill down what are those specific targets that we can then tailor their therapies to. Many of the targeted therapies, some are still intravenous, but many of them are oral. So we are seeing the ability to continue the care in a private home or another extended stay healthcare facility for the patients. Of course, that does produce its own challenges. So we're now looking at adherence as a real opportunity for pharmacists to step in. HOPA has an individual, Shauna Kraft from the University of Michigan. She was a 2014 grant recipient that is actually studying adherence and ways to enhance the mechanisms which patients take their medications to optimize their care and hopefully their outcomes as well. So these are examples that we are starting to see. More and more patients are getting their treatments outpatient and seeing them being treated at home that's maybe 3 or 4 hours away from an academic medical center increases their quality of life and really, I think, enhances their treatment process and what they're going through.